Hi there, and welcome to Psych Waves. I'm Dr. Teresa Anderson, owner and practicing psychiatrist at the Anderson Clinic in Cincinnati, Ohio. And I have a wonderful guest speaker today, Emily Lacy, who is a dear friend and colleague. We've shared several patients. She is the owner and therapist at Aligning Intimacy. Emily, welcome. Thanks for coming.
Hi, Dr. Anderson. Thank you for having me.
I'd love to chat. I would love to chat a little bit about what you do in general.
Sure, sure. So I am a licensed professional clinical counselor and supervisor in Ohio and a LPCC in Kentucky, and I'm a certified sex therapist through ASEX. I also own, as you said, I own Aligning Intimacy Therapy based in Ohio, where there's myself and seven other clinicians here. And we do, we could spend the rest of the time talking about all the different things we kind of specialize in. But generally speaking, we're doing a lot of trauma work with clients, trauma healing. Working with sexual dysfunction, couples, relationships, kind of anything around the realm of intimacy and humans and
Wonderful.
people. Yeah.
That is wonderful.
Mhm.
I know even for the patients that I've seen long term, I think talking about sex is always being perceived as taboo publicly. I mean, even within like a therapeutic relationship, right? I think
Mhm.
some of it has to do with maybe religious upbringing, and some of it is the taboos around sex in general. I think, part of it's being founded by, very staunch religious, like
Mhm.
the pilgrims, there were the people who founded us, and they were like
Yeah.
very
Heritage,
sexually kind of
right?
cut off, and
Yeah.
sort of that's part of our history, and it maintains some of that in
Mhm.
our social awareness, I think, just in our psyche. How do you get past that if somebody's like really nervous about talking about those things or afraid to break things up?
Yeah, I mean that's 95% of my job, right? Is when people see our website and people come in for therapy or for consultations, like they know what we do. It's pretty obvious from our website or why they're being referred, but there's still almost this element of asking permission from us, like the sex therapist, to bring up the topic of sex. And of course, like we talk about it here, but we're very validating in that even when you're coming to a sex therapist, we still need permission to talk about sex. And that's us as a culture. Um, I think I specialize in religious trauma. I do a lot of trauma work with that in sexuality. And I know you and we live in the Midwest, so that's a big part. But even in different regions of the country, there's very different elements of religion that have filtered their way into our sexual awakening, we'll call it, right? Or not. So, purity culture is by far one of the biggest things I see is the impact of purity culture, which is the abstinence only movement. Don't talk about it. We don't, if you have sex, you're going to get an STI or you're going to get pregnant and you're going to ruin your life. And so over time, we're learning this from a youngish age. We learn that sex is bad and we shouldn't do it. But the messaging around that when we get married is, but now you should have really good sex. And that humans don't operate on a light switch like that.
You can't
So
just
when clients
flip it over.
I wish, I wouldn't have a job if we had one of those. It'd be like just turn the light switch on. But it doesn't. It impact, it's a biopsychosocial. There's not just biology or psychology to explain this. The way we think influences the way our body processes work
Mhm.
and vice versa. So I guess the question is like when people come in, like how do we address that? Is it takes time. If you have 30 plus years of messaging one way around sex, that's not going to unravel in
Change
6 months.
overnight. Yeah.
Yeah, we deserve some time to work on deconstructing and unlearning the messages that don't serve us anymore. And only you can determine what that is. And that's what we're doing in therapy. And then implementing and relearning a new way of how we want to be a sexual being. And that's different for every person. So it's very person centered.
So part of that is being comfortable just talking about sex yourself, but also having a good enough rapport with the therapist to be open about those things that we don't normally talk about on the regular.
Right.
then also deciding what it is that we want to be, both for ourselves and with our potential partners or current partners, and what do we want in general, which may be very different from what we were taught.
Yes, exactly. What we want versus what we were taught we should want usually don't correlate very well. And the thing is it seems like, oh, okay, we'll just relearn, but it's very distressing, because these messages are not just do this or do that. They're so deeply enmeshed with shame, and shame is no easy foe to fight. It takes some time when we think of ourselves in a certain way based on what we like or desire or fantasize about.
Yeah, it formulates part of your identity, right?
Exactly. Yes.
I always tell patients the big difference between guilt and shame. Guilt is something that you can own and take responsibility for.
Hmm.
But the easiest way to remember, just I'm just gonna be a potty mouth for a minute, but the easiest way to remember is guilt is I fucked up, shame is I am a fuck up.
Exactly. Yes.
Like
Yep.
owning that identity of
Mhm.
whatever badness that you're perceiving.
Right. And yeah, and I in sessions with clients when we're discussing guilt and shame is guilt can be productive, right? We can work with that. There could be
Absolutely.
actionable things with guilt. Shame's not productive. It's keeping us really restricted, and then we withdraw and we avoid, and then that just snowballs into more.
Self-flagellate and all the
Exactly.
things. Yeah,
Mm-hmm. Yeah.
hard times.
Mm-hmm.
Um, so how do you see, with the rise of social media and streaming everything, how is that affecting people's sexuality, their relationships? I'm very curious to get your point of view on that.
Um, I think living in a culture that craves instant gratification, a lot of those cravings are being met with this topic, and I don't know that we can talk about this without integrating, porn into this, or cyber sex, or even AI now is a huge boom, um, and it's almost there could be anecdotally, correlated with a rise in OCD diagnosis, right, with the compulsionary component to this.
And
Um,
anxiety, especially social pressures, when you can get all your
exactly.
needs met at home, why go out and
Why
like
connect?
risk the possibility of being turned down?
Yes, that and I mean just in even established relationships, long-term relationships, the amount of times I hear if they would just stop scrolling on their phone, maybe we could talk. And half of the time with couple sessions, we're just talking about how do we limit. I mean, I've got mine sitting right here, like how do we limit time on the phone, connecting to that and being stimulated all the time to be able to connect with a partner. I think COVID had a big role in that, just
Oh
the
yeah,
dynamic around
huge.
that. We were stuck inside, we were distressed, and we looked for relief where we could, and it stuck. Um,
That dopamine hit, absolutely.
exactly. And then, we're used to working in offices away from each other, and then we're forced into working at home together. And now we're realizing there's a lot. Anyway, off topic, but
Yeah.
um, I mean, online dating is in and of itself kind of being a potty mouth, like a hellhole, right, for a lot of people because it's just swipe, 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 swipe. And where is the connection with the person? I think online dating can be great. I think it's not going anywhere. Okay, like so we're going to adapt, but also recognizing what is true connection with a person versus what we think we're shopping online, and that's
Amazon. It's
okay.
like
But
Amazon.
yeah, and it's like, okay, I can get a date with 5 different people in 3 days, and okay, but how do we connect with those people once we're in front of them?
I don't know about your practice, but I know in my practice, I have seen a meteoric rise in erectile dysfunction in
Hmm.
people under the age of 30.
Yes.
And from the medical point of view, this used to be what we call an old man's disease, right? This is when your cholesterol built up. This is when you had blood pressure medication on board. This is when it was from the side effects of the medications that you were taking or from cancer treatments or all this other stuff. And now it's more of a psychosocial
Yeah.
issue where if you're using porn multiple times a day, all of a sudden you're with a real person that has needs and
Hmm.
wants to connect, and you're like, oh shit, what am I gonna
Yeah.
do?
How do I do this? How do I
Yeah.
do this? Um, and so also this has always been around with younger individuals. But I think now they're just feeling more open to addressing it. Like we are getting a little bit more information out there with it, which is hopeful. But erotic imagery has been around for
Thousands
centuries,
of years.
literally centuries.
Yeah.
Like, um, so performance anxiety is not new to people, but they are, I think, trying to address it more and looking at how to do that. Uh, To go into it a little bit, the way I look at it is I always team up with like a sex medicine doctor, a sometimes a psych med provider such as yourself, and a pelvic floor physical therapist. We're also working now, especially those born male or those born with a penis, right, are working at desks more. They're sitting, and that is having an impact on their pelvic floor, which is also impacting erectile functioning.
I hadn't even thought about that, but yeah, okay.
Mhm. Yeah,
Yeah.
so a lot of people, especially during COVID, they're sitting. So they're sitting in this like position I'm in, which is actually the worst for one of the worst positions for your pelvic floor, and nobody knows. I have so many, male identifying clients that are like, I have a pelvic floor. I'm like, yeah, we all do. Like, whatever gender, we
I
all
thought
have
that
a
was a
pelvic
girl
floor.
thing.
Yeah, yeah, right. Like, but we all have a pelvic floor. And the muscles work a lot in the same ways. And if we're sitting all day in a certain position, muscles get tight and we have no idea how to stretch them. And then that restricts blood flow, it cramps nerves, which all of that is going to impact erectile functioning. So just like word of advice, if you're like listening and you feel like this could be you, like scheduling in movement and stretches during your work day can probably help with the way your penis operates too. Or go
Absolutely.
see a pelvic floor PT. Um, but from the psychosocial, like performance anxiety is high. Um, and when you're with a partner and all you know about sex is what you've watched in porn, it's not going to work. It doesn't work. Porn is can be a great tool for couples when it's consensual and after there's a base understanding of pleasure and communication and what sex actually is, because what you see in porn is not actually sex. It's the act of it's a sexual act, but it is not intimate, right? And when you're, I don't know if this is appropriate, but with clients, we're saying when you're out in the wild with like real people and humans, like
I love that out in the wild.
when you're out in the wild, like it doesn't work the way it does on the screen. Um, and
And I
neither
think
does
pleasure is
your
so
penis.
very subjective too, that to one individual, a certain act may be very interesting and titillating and exciting, and to another, it's like, oh, hell no.
Hell no. Exactly. That's a lot of it. It's like, porn is not, um, there's some changes being made, but in general, porn is not, I don't know how to say it. It's not female friendly, right? In a lot of ways, there is porn out there, but most of the time, the big genres of porn that statistics show most people are watching is much more rough. It's much more kinky, so to speak. And if we don't have a foundation of safety and intimacy, emotional connection, and
Oh, that's
trust,
rough.
that's not going to work. And if on porn, when they show somebody with a vulva orgasming 2 seconds after penetration, it's a lie. That's not happening. That's not the norm. It's not happening. It's a lie. So we get discouraged. Clients or individuals get discouraged when they're having, penis and vagina sex and it's not working. And then the anxiety comes in and then they lose their erection. Or am I doing this right?
What am
Am
I
I
doing
good enough?
wrong?
Yeah,
Why is she
yes.
not responding the way she's supposed to, or the way I've
Yes.
seen? Yeah, right, exactly.
And our
Okay.
brain's our biggest sex organ, not our genitals. Our brain is. So if our brain is overworking, it will absolutely cut off our functioning in our genitals. So
I saw a hilarious meme, as one is
mm.
prone to do scrolling on Facebook, right?
Yeah.
That had mom porn, and it was a dude doing dishes, vacuuming, taking
Yep.
care of the baby,
Mhm.
bringing dinner to
Helping.
the
Yeah.
table.
Uh-huh.
We're like, wait, what? Yes, but that is
It's
actually very
true.
sexy for some people.
It's
Yeah.
true.
So it's very much what how are you being a good partner, and how are you connecting with the
Yeah.
individual, and that individual's wants, needs, desires,
Yes.
likes, dislikes are very different from what we
Yeah.
see.
And let me, like anybody listening, let me ask you this. When is the last time you've asked your partner genuinely, what do you like? What does sex feel like for you? And what would you like more of? Ask her what book she's reading. You might get some ideas from that. Or just, and when's the
Or even
last
very
time?
specifically, do you like it when I do X, Y, and Z? Do you not like it when I do X, Y, and Z?
Yeah. Or what could I do differently?
Yeah.
Right? People, we are not comfortable as a society talking about sex. We're totally comfortable doing it for the most part. We are much more comfortable acting out and doing sex than we are talking about it. And that we need to flip that script. We have to be able to talk about it to have good sex.
Awesome. I love it.
Hmm.
I love that you're opening up the conversation to people so it doesn't
Hmm.
feel like a taboo, so it feels more natural and more normative, right?
Yep.
That's huge.
Mhm.
Another big reason I wanted to talk to you today is because so many of the medications I prescribe have sexual side effects,
Oh.
especially the antidepressants, some of the
Hmm.
atypical antipsychotics that are used as sort of like mood
Yep.
boosters. And I know in some cases it's like, let's take an SSRI for instance, like Zoloft
Hmm.
or Prozac or whatever.
Yep.
We prescribe those, and hey, I'm less anxious. Hey, I'm less depressed, but I'm a little less interested in sex. Some of
Hmm.
that can be overcome if we work on, especially if it's, one person in a couple, that we could talk about, making intimacy more regularly scheduled, even putting it on the
Hmm.
calendar,
Yep.
um, or increasing the amount of foreplay,
Hmm.
which will help both parties involved, not just the person taking the medication. But sometimes it's not a case where it's like, okay, well, this medication works, but I'm pretty much dead from the waist down. Like, what
Yep.
now? I know
Hmm.
there are medications like Viagra for men and some newer medications for
Hmm.
women that I've recently learned about from my OB-GYN, which is awesome
Yep.
because women
Yep.
have
I
not been on
absolutely.
the drug research scene for a while. And still, of
Nope.
all the clinical trials that are done, less than a third are women, by the way, just putting that out
Oh
there.
yeah. Hmm.
Um, but some of those things have been up and coming, which is exciting. But what, as a sex therapist, do you suggest to couples where one person may be taking medications that lowers their sex drive, or even they're both perfectly healthy, nothing else is going on, but my sex drive is up here and their sex drive is down here?
Hmm.
How do we?
Yeah, absolutely. Okay. By far most common thing that comes through our clinic or our practice, right? Um, so I'm going to address these are two different questions. So I'm going to address the medication one first because this is a huge, I mean, we're talking SSRIs, but we're also talking blood pressure meds, cholesterol meds, diabetes meds, allergy
Cancer
meds.
meds, all
Literally
anything
antihistamines
that
will
is
do
like
it
androgen
too.
receptor, yeah. Hmm.
Anything that could have an impact on your blood flow is going to affect erectile and genital functioning, not just penis, but vulva as well. Um, so part of me even wants to back this up in that we're going on these meds for a reason, right? So they're making us feel better, but then we're so quick to identify a problem. We're so quick to hone in on another problem that we find in ourselves that we have already, what do we call it? Like disqualifying the positive. So could we spend us, we might determine a length of time in session collaboratively of, can we just set this time to enjoy the benefits that you've achieved? Like you just achieved feeling good for something you've probably been battling for a while.
You're
Look how
going back
quick
to
it
work,
was.
you're doing ADLs and housework, you're
Right.
going out with your
You're
friends, you're able
playing
to
with your
enjoy your
kids
hobbies
again.
again. Yeah.
Yeah. So look how quick we were able to jump over to find a problem within ourselves. So let's just like, yes, we can work with that, but let's spend some time enjoying where we're feeling good for a minute.
Gratitude is where it's at.
Yeah. And then sometimes that can naturally kind of combat the effects of the medicine. But there is some very real physiological effects of these meds.
Absolutely.
Um, so kind of to your what you were saying, there's a lot more discussing sex. The more we talk about sex, the theory is the more we talk about sex, the more that we're willing and able and excited to engage in sex. So I'll say this 10 more times during this probably, but like talk about it more, talk about it in a fun way. Sex is heavy to everybody right now. Let's make it fun again, right? That could just be If you're into watching porn together, do that. You don't have to have sex. And again, why is orgasm the only goal of successful sex? We can have really good sex that doesn't have to end in an orgasm. It doesn't have to. And that's really challenging a long held societal belief of like getting off is the only way you know you did it right. And that's not true. It's just not. Some people can never do that, like anorgasmia. Like it's maybe just not going to happen. It's just pain. Some people have very pain, like penetration can be painful. So for meds and mismatched or desire discrepancy in and of itself without meds, usually as sex therapists, we're implementing, well, I am anyway, a therapy called Sensate Focus, which is a like exposure-esque type of therapy. So it's a series of like guided touching exercises that sex is off the table while you're doing these. Like it's just about
It's almost like a sexual
retraining
meditation without pressure.
it without pressure is the key right here. It's a
Yeah.
systematic
Okay.
desensitization behavioral therapy, right? So it's you're touching each other, but with this intention of sensation. You're not thinking about what your partner's experiencing, and that's really hard not to do because you're trying to please your partner, but you're focusing on how am I experiencing temperature, pressure, and texture? Because when's the last time somebody's had penis and vagina sex or just any kind of penetrative sex and you actually could tell me what those three things feel like, right? Because usually it's like, oh, I got to get to orgasm. And how close am I or how far away am I? You know? So it's that our internal process, our introspection. We back to your scrolling and like TikTok and all these things online. We're outside of our body all the time. And so this is training you to get back into how can I, even if you have a perfectly healthy sexual relationship, this could be helpful in just making it even better. If we can take in more sensation internally, the more heightened the sensation of sex will be. So
The
when
more
medicine
present
is
you are.
impacting that,
I love that.
we go
I
back to
love
our
that. That is so
internal
cool.
system. hmm It's my
That is
favorite
very
therapy.
cool.
Yeah.
I love that. I love learning new things.
Mhm. Yeah.
So, when medications are an issue, but there is a significant discrepancy in drive or desire, let's
hmm
say just our standard hetero couple, dude wants to have sex every day or every other day, woman's okay with once every other week or so.
hmm
Where do we go? How can we compromise? What do we do in terms of expectation?
hmm So reducing expectation for when the expectation, right? The expectation, the obligation, the pressure is what's killing. It's a break for almost everybody.
Okay.
Emily Nagoski talks about this in her book, Come As You Are, like breaks and accelerators. And
I love that book, by the way.
it's so good. Everybody should read it. I give it to
Yeah.
everybody.
Yeah.
Um, breaks, but it could be that expectation, like I have to do this versus I want to do this. It takes away your choice. If I have to do something, it's a task on the to-do list versus I'm choosing to do this because I want to. It's like I
Mhm.
have to do this or else what? And there's the question. And that's what we're getting into in therapy is what does it mean about you if you don't do this?
Hmm.
And then you're like, oh, shit. Um, I know that's a question I've asked myself too. I'm like, oh, it means I'm not a good partner or I'm not they're going to leave me or it's enacting a lot of fear response that maybe we've never addressed before, and so that's what we're
Or I'm not
digging in.
reciprocating in this way. Does this mean, yeah, the
What does it
judgment
mean?
call? The judgment
Yeah.
call. Yeah.
Yeah, and so with couples it's we're digging into sexual history. What did you learn about sex? How do we unlearn some of these things that aren't serving you guys anymore? Creating a new sexual narrative for the relationship. And then it's never setting a goal on frequency. It's setting a goal on how often are we talking about things,
Ooh, I like
not
that.
how often are we doing it.
I like that a lot.
Yeah.
So in our practice, our bread and butter is sort of treatment resistant depression and PTSD, right? So with
Mhm.
PTSD, you have a lot of people who have the history of
Mhm.
sexual traumas, and when there's such a gigantic
Yeah.
discrepancy, almost always in either one, by the way, or both, there's
Yep.
some sort of history of sexual trauma, like in the person maybe who wants it all the time or multiple times a day, is like there's a history of inappropriate touching or sexual contact at a young age, or the person who doesn't ever want it,
Hmm.
it could be a situation where they were raped or forced or what have you.
Sure.
Um, but that being said, outside of those traumatic incidences in childhood or younger life or what have you, we also just have the season of life sometimes, right?
Oh
Like,
gosh, yes.
if you're a busy mama of three and you own a business and you're expected to get dinner on the table and you're expected to do all the childhood pressures, like, sex does feel like just another thing on the chore list, right?
Yep.
So, a lot of times when I'm counseling these couples, I talk to them about see this as a season
Yes.
and trying to be more intentional about time together. Not just sex, but
Hmm.
having a date night where we're not talking about paying the bills. We're not talking about who's getting Jimmy to soccer
How
practice. We're
we're
not talking about who's
yes.
being there for the roofer on Thursday. Like, have a separate business meeting where you take care of all that crap.
Yes.
And
Yep.
then have one where you just focus on your relationship because when the kids leave the nest, that's all you have left.
Yeah. And then got a lot of those clients in my office right now. Kids are off to college and they're like, what do we do? I was
What
like,
now?
oh,
I don't know this
right.
person anymore.
I always say like, you wanna test how good your sex life is like have kids and you're gonna understand, right? Like I have two. Okay, my husband and I both own a small business each. And we that's something we're currently trying to create the dynamic around is like how do we have time together where we're not talking about work or the kids? And it's hard and I
Or
know
the
I have a car.
house, or the to-do list, or the
Yep.
finances, or the state of the world in general. Yeah, all the things.
Oh, well, yeah, there's that.
There's a
That thing.
whole separate podcast on that one.
Yeah, like don't get me started. But
Dude, not going
yeah,
down that road.
yeah, starting with therapy can be one of those things, not just the like plug therapist, but truly it's a time set apart to talk
Yeah,
about what's going on, and sometimes that's uncomfortable, but at least we're talking about it.
yeah.
Um, but
So I'm curious, especially like I said, with the person who may not be in therapy or has a history of childhood trauma. I know a lot of the reactions that I get from the other partner or spouse is every time I bring this up, they're defensive. How do I even
mhm,
bring it up without them, going all
mhm.
feral on me or flipping it back to me? How do I talk about this in a way that's loving and kind and gentle and understanding, but still we're getting there talking
Mhm.
about it?
And you're talking about like just the topic of sex in general.
Yeah, yeah. Or even like one person, like you said, has an enormous amount of, let's say that you're the person with the lower libido, let's just say.
Sure.
And the person with a higher libido is like, hey, I want to talk about this. And this person feels pressured and shame because they are not giving them as much intimacy as they prefer. And then they bring it up and they feel like they're doing something wrong even more. And so, how does this person bring it up to this person with a lower libido without causing defensiveness? Or if the defensiveness goes up, how do we get past that and work towards just talking about it? Not pressure to do it, just talking about it.
Right, just having the conversation.
Yeah,
Well, first is
because not everybody's in therapy.
right, not everybody's in therapy, even though everybody should be in therapy at some point. I'm say it, I don't care. But
Yes.
we don't, we can't control the way our partner is going to respond to things. So the more that we try to manage our partner's reaction, the more that we're impeding our ability to be vulnerable and have communication. So, I mean, this is like maybe we need to practice communication around topics that aren't even about sex, right? Maybe we're jumping too far ahead for that. And creating a safe space for vulnerability. How do you do that? Um, and so I have this exercise I do with clients that is really breaking down when, and it has to be an intentional conversation set apart, but when have we had a conversation that went well? I left there feeling good. Let's dig into what was the setting? How did I feel safe? What was it about you that made me feel safe? And helping to recreate that in future conversations when sex is the topic, right? Um,
Ooh, I love that because it's
Curiosity.
post-mortem of it's like breakdown of a good conversation, not breakdown of a bad one. I like that.
Exactly. Now, that's the flip side. You're going to break down the bad ones too.
Well, of
You know,
course.
it's
I
like
mean,
you're going to have more of that. You're going to have more of that typically, but we disqualify the positive all the time. So relearning what went right, how do we recreate that to continue adapting so that we have this safe space to be able to talk about hard things. We are adults that live busy lives in a wild culture. We're going to have to talk about hard things, and we can't aim to be comfortable all the time with our partner. Okay. We grow as a relationship as we're getting uncomfortable with each other. Um, and it's not a bad thing, right? We're not supposed to feel good about a partner all the time. That's unrealistic. It's unrealistic. And my husband can attest. I promise. Um, but the topic of sex is we start by see even that conversation, we're starting it by talking about what's wrong or what we want more of instead of introducing the conversation with curiosity. It's, hey, tell me what do you actually feel about sex? Like, when have you enjoyed it before? Or what do you like to read about? Like, showing curiosity and interest and investment into our partner can go a long way versus focusing on the problem set.
That's huge. That's huge.
Yeah,
It
like for
also
me,
lowers the
yeah,
defensiveness. Huge.
we're yeah, we have defensive parts. Those are going to be there. They're strong. They've been there since childhood. They're not they're not new. So if we think we're going to outsmart our partner's defensive parts, well, maybe somebody made it work. I've never seen it work. So why can't we get curious about the other parts that don't get a spot to speak?
Being curious is huge because that is lacking judgment.
Yep.
It's lacking assumption.
Hmm.
It's also detaching from the outcome, right?
Hmm. And
It's
showing
like, I'm
interest.
curious, whatever you say, I'm open for it, whatever you
Yep.
say. And that's lovely. I think one of the goals we were always taught, the goals of psychotherapy are obviously reducing symptom burden, right?
Yeah. Yeah.
Improving functionality. But what surprised me as a young buck way back in the day
Hmm.
was the ability to tolerate uncertainty
Yes. Oh
and
my.
owning that discomfort. And this is not always going to be easy to discuss, but if we get past this, it's like we level up.
Yes. That's exactly right. And you go through it together, right? You don't see it when you're in it, but um we are very geared towards noticing when we're uncomfortable. Disappointment is big when we talk about sex, especially with mismatched libido.
For sure.
Everybody's feeling disappointed, not just the partner with higher libido. Everybody's feeling disappointed. And disappointment is a very normal, natural, healthy human emotion, right? But we don't think about it like that initially. We think of disappointment, I need to fix something or I did something wrong. And so we try to fix it. So we're either analyzing what went wrong or we're in the future trying to figure out how do we fix it. When really, when we're feeling disappointment, we need to be in the present with our partner on, let's talk about this. We're allowed to be disappointed. That doesn't mean I failed as a partner because my partner's disappointed we didn't have sex that night, right? We can hold space for two things to be true.
I love that. Holding space for two things to be true.
Mm-hmm.
It's just like my son. He just graduated his elementary fourth grade. And he said,
Mm-hmm.
Mommy, I'm very happy to be going to my next school. I'm very unhappy to be leaving my current school because I love my teachers. And I said, that's what we call bittersweet.
Yeah,
Both things can be true at the same time.
that's exactly right. And that happens all the time in here. And with sex, I'm happy we're having sex, but maybe I don't like the sex I'm having. And it's like, okay, good, we talk about that. But disappointment's part of this process. And we learn how to get comfy being uncomfy. It's the saying, right? Mm.
And just bringing, again, communication,
Yes.
talking about it, bringing it out in the open, no judgment, no demands, no
Hmm.
expectations, but just, for lack of a better term, putting it on the table.
Yeah. And you have to be, I don't know if this is going too far with it, but you have to be confident and comfortable saying no to sex before you're going to give any freely given yeses, right? If a yes is always out of obligation or the no isn't an option, is it ever really truly a choice? Now, I'm not talking about consent and assault. That's not where I'm going. This is if I feel bad about myself for saying no, then is the yes ever an enthusiastic yes, which is what we want.
It's a great point.
Hmm.
You want your yeses to be hell yeses.
Yes, exactly.
I love it.
Mhm.
I love it. Oh my gosh, this has been so productive and so fruitful, and I always learn something new when I talk to you. I'm so excited that you came on the podcast today. Oh my gosh. So, if a person or a couple wanted
Mhm.
to chat with you or any member of your team, how would they get in contact with you?
Sure. So there's a couple different ways. Our website, which is just aligningintimacy.com, that's probably the easiest way to do that because you can see all the therapists on there. You can see our rates, everybody's schedule. You can book online. You don't even have to call us. You can just do everything online.
Cool.
Um, and you can book. We offer free 15-minute consultations, and you can have those with however many therapists to see who would be a good fit. We have two offices. We have one in Mason and one in Walnut Hills. Um, yeah.
Very cool.
hmm
That's
And all of our
exciting.
emails are online too. So you can reach out to therapists individually.
Wonderful, wonderful, wonderful. Cool beans. Well, guys, if you like what you heard, a little bit more about aligning intimacy, or if you're interested in the Cincinnati area, learning more about how to treat treatment resistant depression, anxiety, PTSD, or concussions, give us a like, follow, and share. We are at Anderson Clinic Cincy with a Y on TikTok and Instagram and Facebook. And online, we are www.andersonclinic.net. And you can also reach out to us by traditional old school phone, 513 321 1753. Start feeling better faster.